Hey guys, welcome back to this YouTube channel. So if you're new here, I'm requesting you that you subscribe, like, share, comment, and most important, don't forget to turn your notification bell so that every time I post a video, you get notified. So today I'm going to explain these words that usually confuse a lot of people. And what are the words? The words are vaginal discharge. That is number one. Number two, we have vaginal coitus, not vaginal, coitus, incontinence in female. And number three, we have female ejaculation. And number four, we have squinting during sexual intercourse. So the words are squinting, vaginal discharge, ejaculation, and coitus incontinence. So let's start with this common one, vaginal discharge. So, what is vaginal discharge? Vaginal discharge is a clear white or off-white fluid that come out of your vagina. So, your uterus, cervix, and vagina produce vaginal discharge, which is mainly made up of cells and bacteria. It helps to clean and lubricate vagina and help fight off bad bacteria and infection. Discharge from your vagina is natural and normal process, but changes to your discharge can be a sign of infection or a disease. Women or people assigned female gender are varying amount of vaginal discharge. They have varying amount of vaginal discharge. Some people produce more discharge, others less discharge. Others and have a very minimal discharge. So changes in the color, texture, smell, or amount of usual vaginal discharge means there is a problem. In most cases, abnormal vaginal discharge are treatable with medication, mostly antibiotic. So what is considered normal vaginal discharge? Let me tell you. Normal vaginal discharge usually should be clear or white. Okay? It should not have any bad smell and it should not be thick throughout except when you are menstruating. So we have some of the characteristics of vaginal discharge, and these include texture. So it is normal to have a vaginal discharge that range from watery and sticky, thick and pasty. So your body's hormone cause these changes to happen, but factors like infection can cause changes. Can also cause changes and consistency of vaginal discharge. So vaginal discharge that is chunky, foamy, or accompanied by itching and changes in color may mean you have an infection. So let's talk about the color. So vaginal discharge is healthy if it is clear, milky, white or off-white or dark yellow, brown. Okay, I'm confusing about something. So I'm saying healthy vaginal discharge is clear, milky, white or off-white. But dark yellow, brownish, greenish or gray discharge may indicate an infection or any other issues. Again, let's talk about smelling. Vaginal discharge may have an odor, but it shouldn't be strong and shouldn't be unpleasant. So if you have noticed a fishy or foul smells to your discharge and it is accompanied by changes in texture or color, you may have vaginal infection. Let's talk about the amount of vaginal discharge. Some people produce a lot of vaginal discharge while others produce less. I've already said that. So certain factors like pregnancy can make the vaginal discharge to increase. Birth control and ovulation can also affect how much your vaginal discharge you may have. So sudden changes in the amount of vaginal discharge you produce could mean something is wrong, or maybe you are pregnant, you are using some birth control pills, and so many other things which are interfering with your hormones, and also things that are not right for you, for your body. So in case you get these things that I'm going to list, make sure you contact your healthcare provider, because you might be having a problem. So if you get an increase in the amount of vaginal discharge, abnormal increase, we said during pregnancy and ovulation, or when you are using some contraceptive pills, vaginal discharge might increase. But if you are not on any other conditions that I've mentioned, then if you get an increase in the amount of discharge, or if you are not even menstruating and you got increased amount of vaginal discharge, run to the hospital. A change in the color of the discharge, run to the hospital. A false smelling order, run. A change in texture or consistency of the discharge, kindly run to the hospital. Irritation, itching, or painful in or around your vagina, run to the hospital. What does the color of the vaginal discharge mean? So we are going to look at some of these colors. What do they mean if you experience them or if you see them? The color of your vaginal discharge can mean there is a problem. So if you experience yellow, gray, or green, yellow, gray, or green discharge may suggest a bacterial or sexual transmitted infection. Yellow, gray, or greenish discharge may suggest you have a sexual transmitted infection or bacterial infection. Brown or red discharge is usually related to irregular menstruation or pregnancy, or implantation, bleeding. If you have brown or red thing discharge and it is not on your period days, it may indicate a problem. Clear and white, clear or white. Normal vaginal discharge is clear or white or off-white. If your discharge is white but seems thick, then if it is clear, white, but seems thicker than usual or causes itching, it may mean you have yeast infection. So contact your healthcare provider. So if my vaginal discharge changes, do I have an infection? So I've already answered that, and you should rewatch the video. So what are some of the possible causes of infection and all these changes that might happen to your vagina? We have yeast infection, we have the trichomoniasis, we have bacterial vaginosis, and we have gonorrhea, among other that you should list or you should go and research. Okay, so that is what I wanted to talk about concerning vaginal discharge. Now you know if you have a certain color, what it means. Yeah, you know everything about vaginal discharge. So let's look at female ejaculation. Yeah, let's look at female ejaculation. That is also another word that usually bring confusion, because some people doesn't know, or they usually think that female don't ejaculate. Female usually ejaculate, or ladies usually ejaculate. So we are going to look at this female ejaculation. And so stay tuned. Don't forget to like the video as we are continuing. So female ejaculation is characterized by an expulsion of fluid from the skin gland at the lower end of the urethra during or before an orgasm, not organism, before or during orgasm. It is also known as squinting or gushing, although research indicates that female ejaculation and squinting are different things. Now we're going to look at the differences. Is it a must if you have female ejaculation you must have squinting? We must see or look at that. So female ejaculation refers to expulsion of fluid from female urethra during orgasm or sexual arousal. The urethra is the duct that carries urine from the bladder to the outside of the body. So this ejaculation fluid, this type more closely resemble male semen. It is typically thick and appear milky. So the urethral gland produces this fluid. Other names for this gland are skin gland. So we have said it's usually resemble the semen or the male ejaculation. It's mostly similar or more or less similar with this male ejaculation. Now let's talk about squinting. Squinting is a fluid. Okay, something else that I want to say is that female ejaculation comes from skin gland, not from the bladder. It comes from the skin gland. And the pyorethral gland is the one that produces it. The pyorethral gland is the one that produces it. So squinting, this fluid is usually colorless and odorless. It originates in the bladder and similar to composition of the urine. This fluid can sometimes contain protein. Okay, it can contain all the components of urine. And this fluid people usually experience it during sexual intercourse, and it can sometimes come at the same time the woman is ejaculating. Another thing that I want to say about this squinting, not everyone can squint during sexual intercourse. Not every woman will squint during sexual intercourse, but most women usually ejaculate during sexual intercourse. So another thing that I wanted to explain was coitus incontinence. Coitus incontinence, or during sexual intercourse, you find that the perineal muscle usually relax. So coital incontinence is the urine leakage that occurs during sexual activity. The leakage can occur either during penetration or during orgasm, and it is spontaneous. Leakage during sex points to another form of the disorder. Leakage during sex point to is a form of another sexual disorder, which can be called urinary incontinence. So it is also, some people usually have that and they consider it as normal. But if you are someone who doesn't usually experience it and you experience it as for the first time, you might be having another problem, which can be a urinary incontinence. So I will stop from there, and in case you have any question, you are free to ask in the comment section. If you want me to talk about anything, you are free to write in the comment section. I will stop Now from there, bye till next time.